Welcome to Save Your Money, Save Your Teeth here on E-Radio, the go-to podcast where curiosity meets dentistry. It's straight from the experts. I'm Eon, and every week chatting to Dr. Clifford Yudelman from OptiSmile as we take a nice deep dive into the world of dental care from a consumer's perspective. Whether you're looking for just to brighten that smile or protect your wallet, we've got you covered with practical advice and also the latest insights. So stick around as we uncover the secrets to maintaining both your dental health and also your finances. Today discussing the power of professional cleanings. A big welcome to you once again, Dr. Yudelman.
Hi, Eon. Thanks for having me back. It's great to chat to you. And today I'm looking forward to talking about dental cleanings after last week's episode about checkups. I think the two go together very nicely. So fire away.
Doctor, why are professional dental cleanings so crucial for maintaining optimal oral health?
So the professional cleanings actually remove plaque and tartar that your regular brushing and flossing can't get to. It helps to prevent gum disease, tooth decay, and other oral health issues. And regular cleaning support overall health by reducing the risk of oral infections, which, as we've spoken about before, can affect other parts of your body.
Okay, and how do professional cleanings complement at-home oral hygiene routines?
So to go further on that, the professional cleanings provide a deeper clean than your at-home care, and it reaches areas that are difficult to access. It offers us an opportunity, or the hygienist an opportunity, if you're seeing a hygienist. Some practices, the dentist does the cleaning. In other practices, there's an oral hygienist whose job it is to do the cleanings as well as to educate you on oral hygiene. But it offers the dentist or the hygienist an opportunity to educate the patients on proper brushing and flossing techniques. At OptiSmile, we often will put a purple dye or a blue dye on the patient's tongue, and they swish it around and they spit out, and we can show them where all the plaque is and or tartar, and then we use that to know where to clean and also to reinforce the benefits of the daily oral hygiene practices, and this ensures comprehensive care.
So, Doc, what can patients expect during a professional dental cleaning at OptiSmile?
So usually there's a scaling to remove the plaque and tartar. This is after we've, dyed the plaque and tartar with a little pill that we mentioned. And then also polishing your teeth with either a polishing brush. We have an air polisher that basically shoots out. It's like a little mini sandblaster, and that gets between the teeth. If it's been a year, you'll have a thorough exam, not only by the hygienist, but by the dentist. The dentist or the hygienist at OptiSmile, we use what's called Piezo ultrasonic scalers. That's a little high-pitched machine that's very gentle. It runs along the gum line. There are different types of these scalers. If it's not being used properly, it can be very, very sensitive. Some people hate those things. Other people love them. And it's the same with hand instruments, where the hygienist or dentist will put a metal pick between your teeth and scrape like crazy. Some people absolutely love that and other people hate that. So having a few different tools at one's disposal is great. But very often, if you get a cleaning with an ultrasonic scaler, one should finish up with hand instruments and then polishing. We always floss the patient's teeth and let them watch in the mirror so they can get a better idea of how we do it. And in some cases, the patients will get a fluoride treatment and also special advice on what types of brushes to use. If they have bad breath, we may dispense or recommend a tongue scraper. We've got special mouthwashes that have chlorhexidine and other types of different toothpaste. There's lots of different professional toothpaste. In fact, we're going to do a complete podcast on all the different types of toothpaste and mouthwashes and oral hygiene products in the near future. So that's what happens when you get a professional dental cleaning at OptiSmile.
Okay, and then how often should someone get a professional dental cleaning? And does this actually the frequency vary?
That's a great question, because we get patients that maybe haven't been in for 18 months and they'll come and see me for an exam, or maybe something feels a bit rough, or they feel like they've chipped something, which brings them in, and they haven't had a cleaning in 18 months, and they've barely had any fillings or problems before, and they're brushing and they're flossing, and they're not a smoker, and they don't drink huge amounts of tea or coffee. And we have a look, we do a checkup, and we might say, oh, you're fine, you don't need a cleaning. The cleaning is for a specific purpose. The cleaning is to actually clean stuff that's on your teeth. It's not just because the insurance or medical aid pays for it. So that's on the one end of the spectrum. On the other end of the spectrum, like yesterday, I saw a patient. He had been for a full initial examination and X-rays at another dentist, and he got a cleaning with the hygienist at the other practice, literally maybe about a month ago. It's a very good practice. So I believe they must have done a good cleaning for him. I didn't know that he had a cleaning there because, to be honest, there was a lot of tartar behind his lower front teeth, which must have built up very, very quickly in the last month or 6 weeks. And so that patient, if we saw him in another 6-8 weeks, he looks like he needs a clean every 3 months. Whereas, most people, it's recommended every 6 months. But I think, if you go in today and you get a clean and you go back in 6 months and the dentist scrapes a little bit behind your front teeth and gives you a quick polish, and, the charges your medical aid 900 Rand or 1,500 Rand, whatever it is, and you feel like you're only there for 10 minutes, you might want to ask them, do I really need this every 6 months? Maybe I only need this every year. And more importantly, especially if you're paying out of pocket. But I think whether medical aid pays or you pay, it's still, one shouldn't do things that are not necessary. And on the other spectrum, if your medical aid only pays for a cleaning every 6 months, or that's what you feel you can afford, and the dentist can see that it's not enough for you and they recommend that you come every 3 months, then follow that advice. I think it should be personalized based on your own oral health status.
Doctor, what are the main differences between professional cleanings and at-home brushing and flossing?
Yeah, so, these machines and polishing cups and polishing brushes, they're just a lot more, I think, for want of a better word, they're more effective at getting under the gums. They're more aggressive. They're things that you can't really do yourself at home. When the tartar starts building up under the gum, that's when you start getting bleeding gums. And it's just all around, after a dental oral hygienist visit or a cleaning with a dentist, your mouth is going to be much cleaner than before you came in. And then you just got to maintain that at home for the next 3, 6, or 12 months, whatever, your specific situation is.
What are some common misconceptions about professional dental cleanings that you encounter?
So some patients believe that cleanings are painful or should be painful or are always painful. But modern techniques and in some cases we can use anesthetic. You shouldn't have pain. There may be discomfort, especially if you haven't had a cleaning in a long time. And the other misconception is that professional cleanings are not necessary if you brush and floss regularly, but they're essential for comprehensive care. And the other last misconception that I can think of is people think that cleanings can damage their teeth, but they're actually designed to preserve and enhance your oral health. And look, yes, if you've got an inexperienced dentist or a hygienist that puts a ultrasonic scale on full blast and hasn't had proper training, and it's painful, they can possibly chip or break a filling or damage your tooth, but that would be really the exception. It should feel more like you're having a spa treatment. We get a lot of Google reviews from patients who've just only ever had a cleaning. They've never had fillings or root canals or anything. They just love the experience. We get great feedback. at OptiSmile. People love coming in for cleanings.
And how do professional cleanings help in the early detection of potential dental issues?
Yeah, so along with the cleaning, once the teeth are clean, then it's much easier to check them more thoroughly, looking for signs of gum disease, which we discussed before, bleeding gums, cavities. If someone's got a lot of plaque on their teeth, after it's been scraped off and polished, one can see if that plaque has actually caused the cavity, and we can, have a general look around to look for any other, oral cancer and sores or any ulcerations, things like that. Be more timely, with our treatment recommendations during these cleaning appointments. And if there's a hygienist and a dentist, a lot of the time the hygienist may see something and then ask the dentist to look at that on your behalf, which happens very often at practice. That's a sign of a great oral hygienist. They're always having a good look when they're cleaning. They're not just doing it brainlessly.
Doctor, what advice do you give your patients to maintain the benefits of a professional cleaning between visits?
Well, we not only encourage consistent, daily oral hygiene practices such as brushing twice a day and flossing, but we also ensure that the patient knows how to do it and demonstrate it to them. Although there is a code and you could charge a fee for doing this, we don't charge. We think it's part of the visit. In some cases, we'll recommend an antimicrobial mouthwash for certain patients that are struggling to control their plaque and where they have gum problems or bad breath. And we can advise on maintaining a healthy diet, limiting sugary and acidic foods, and other things that can harm the teeth.
And our final question for today, how does OptiSmile ensure a comfortable and effective cleaning experience for patients?
So we offer patients a blanket. We've got headphones if somebody doesn't like the noise. Our hygienists and our dentists, we use the very latest technology and techniques to ensure a gentle yet thorough cleaning. We have a lovely ocean view. Although sedation is an option, it's very rare. Some patients need to take a sedative just for a dental cleaning, but if that's what somebody wants and they're very deathly afraid of getting any instruments in their mouth, then we can help them with that. In some cases, we'll put some anesthetic gels or even numb a patient if there's a particular area that needs a deep cleaning. And, we focus on patient education. We explain every step of the process to alleviate any anxiety and to ensure a positive experience at OptiSmile. And I'm sure many other dentists around the country do the same. If you're not in Cape Town and there's a dentist near to you, I think most people can expect very similar, all the things that I say in my podcasts. You don't have to come to OptiSmile to experience modern dentistry and to not only save your money and save your teeth. So it's about both.
And going to the dentist with an ocean view, I mean, what more can you ask for? I wouldn't even need sedation. That's more than enough. That's great. And that wraps up another episode of Save Your Money, Save Your Teeth. Dr. Yudelman, thank you so much once again.
Thank you. Thanks for having me on, and look forward to speaking to you again next week.
Next week, same time, same place. Also remember, while we strive to provide valuable insights, always consult with your own dental professional for advice tailored to your personal health. Don't forget to subscribe for more enlightening discussions, and join us again next week as we continue to explore the fascinating intersection of dental health and financial savvy. Until then, keep smiling and taking great care of your teeth.
Discover the world of dental excellence with OptiSmile. Join us for a weekly podcast featuring Dr. Clifford Yudelman, a seasoned expert with 40 years of dental experience across 4 continents. Gain unique insights and expert dental advice by visiting optismile.co.za for articles that illuminate the path to optimal oral health. If you're seeking unparalleled dental care in Cape Town, get in touch with OptiSmile or book directly online on optismile.co.za. OptiSmile, where global expertise meets local care.